Any thoughts on future considerations? Well, I think in terms of future considerations, I think we need to think about where we are now and where we want to go. During this time where your practices may not be in operation or at a very reduced activity, think of this as an opportunity to review your policies and procedures, to do some training with your staff so they are prepared when it comes time to go back to reintroducing patients into the practice. It's time for continuing quality improvement measures. You have time now to do chart audits, in-office or virtual non-office in-service trainings with staff that aren't present, infection prevention and control training, OSHA bloodborne pathogen training, HIPAA training, that you can take advantage of that time to do these things with your staff while you're not in full operations. And then create the plan, your plan for preparations for reopening, preparing messages for patients both during this time, so you're in touch and in contact with your patients, but also when it's time for people to begin making those appointments to come back in for regular procedures. Eve, did you have anything to add to this?
Sure, Kathy. I think, even just speaking from personal experience, going through this with our university and a clinic that, treats 400 or 500 patients a day and now can only see, a very few. It's a time to reflect on what we wish we had known or had or been prepared for when this occurred, because there's no guarantee that once this is over that something similar can't happen again, or that there might be some form of rebound. We just don't know yet. I think China, with its experience now of lessening disease burden and fewer deaths, in fact, I believe they've had no deaths now for a couple of days, we're going to be able to see if this disease does have any kind of a rebound. We don't know if this is a seasonal infection or disease, or if it's going to carry through into different seasons. It doesn't show any sign of stopping with improved weather like the flu might. So I think just reflecting on that, updating your emergency preparedness protocols, and I think going through this experience is going to teach us a lot about that.